Hi, I'm Christie Ballantyne. I'm the Chief of Cardiology and Cardiovascular Research and the Director of the Center for Cardiometabolic Disease Prevention at Baylor College of Medicine in Houston, Texas. Well, this has been an exciting meeting about where we stand for PCSK9 therapy because we had a late-breaking study this morning called Vesalius. And we knew that there was benefit in secondary prevention, but this showed very strong benefit in high-risk primary prevention. This was a monoclonal antibody, evolocumab, every 2 weeks, but had a 25% reduction in by the primary endpoint. But what was really very important thing, it showed actually reduction in total mortality. So it was exciting news, and it further expands, I think, the patients that we're thinking about. Not only secondary prevention, not only familial hypercholesterolemia, but also high-risk primary prevention. PCSK9 is really a target that came up from biotechnology because of genetic loss of function variants. And so it's been fascinating to watch as you had the monoclonals, that's blocking protein, you had the siRNAs blocking protein synthesis, and then there's the development now of a macrocyclic peptide that blocks the interaction of PCSK9 with the LDL receptor. So it's a kind of a big small molecule that works like a monoclonal. It blocks those two proteins from interacting with each other. So there were two studies presented at this meeting. The name of the molecule is enlicitide. I was the PI of one of them is with heterozygous FH. We know that's an important patient population. The other one is people with secondary prevention or high-risk primary prevention. But both of them showed there was very good efficacy, similar to the phase 2 studies, around 60% LDL reduction, and very good reductions in non-HDL cholesterol, around 52%, ApoB, about 50%, and also lipoprotein A, around 27-28%. So there are two phase 3 lipid studies. There has been a phase 2 dose-ranging study, looked at various dosage, but it was short-term, only about 12 weeks, and it showed that you got about a 60% reduction. So these looked at the dose, and they carried it forth into a phase 3 program, two important patient populations. So one is heterozygous familial hypercholesterolemia, and this study enrolled, it's a 2-to-1 randomization. It was about 300 participants, 12 months of follow-up. Always important, you want to see what's the duration, does the therapy keep working? And then also for side effects, you need a longer duration and also bigger numbers. The second study, and that was it's called CORALlipids, and it was looking at high-risk individuals, a mixture of secondary prevention, high-risk primary prevention, same design of 2-to-1 randomization, but now a bigger study, about 2,900, so closer to 3,000 patients, about almost 10 times as big, and also, again, with 1 year of follow-up. Showed very similar results in regards to the non-HDL was about 52%, ApoB was about 50% reduction, good reductions in LDL cholesterol in that study also. So very concordant data, and both of them showed good safety profiles with it. Basically, the discontinuations due to adverse events were, the same or less than placebo numerically in both studies. Didn't see any big warning signals in regards to things that we might have worried about, like liver function test or muscle problems. So very encouraging in terms of the data we have about at least the lipid efficacy for this therapy. So I think if we look at this CORALreef program, we got 2 trials, and one thing you always want to see is, are the results concordant? I mean, do you see? Hopefully, you're going to see things confirmed in one study versus another study. So they confirmed the phase 2 data, 2 different patient populations, longer studies, larger studies, seeing the same kind of efficacy, no new safety signals, and importantly, there's a large outcomes trial with this agent that's also fully enrolled. So it's always nice to know that there's more safety data accruing and that we'll have outcomes in it. It's going to take a number of years, though, for that study. The study we saw this morning had 4.2 years median duration of follow-up. So I think that's what you'll need in those types of studies. So that study is fully enrolled. but it's going to be a number of years, at least a few years before we have the results of it.